Hello dear friends, I Dr. Shamsher Singh welcome you all to my YouTube channel Pharma Learning. So today I am going to discuss with you about the next GPAT question series which will be a part 18. In this series I will discuss more about the GPAT questions which are very useful for you all. Hope you will like, watch and subscribe the Pharma Learning channel. And so we will go to the first question. Which of the following is a non-selective but very potent and efficacious bronchodilator that is not active by the oral route? The option for this question are aminophylline, cromolyn, epinephrine and ipratropium bromide. So you can choose the correct answer. The correct answer for this question is epinephrine. So epinephrine, you know that it is a more potent and efficacious bronchodilator, but it is not orally active because the reason is it is degraded by some proteases and it is not active in the gastric pH. So that means the pH of your stomach as well as the proteases enzyme they degrade epinephrine. So orally the complication if you will give at a higher dose will be more. So this is the right answer for this question. The next question, in patients of bronchial asthma, inhaled corticosteroid achieve the following except. The options are reduce the need for bronchodilator medication, control an attack of refractory asthma, reduce bronchial hyperactivity, and reverse diminished responsiveness to sympathetic bronchodilator. So you can choose and comment the right option for this question. The right option for this question is control. So that means the corticosteroid are not preferable, or you cannot say they are responsible to control an attack of refractory asthma. So basically what is refractory asthma? The symptoms of asthma which are persistently appeared in the patient. So this is a type of refractory asthma. So in this case, corticosteroid are not the first choice. You can use some other bronchodilators or anti-asthmatic drugs. And second choice could be a corticosteroid. Basically, you can say prednisolone. Prednisolone is sometimes preferred in case of refractory asthma. So this is a right answer for this question. So the next question is, smooth muscle relaxation is due to stimulation of which type of histaminergic receptors? The options are H1, H2, H3, all of the above. So you can choose the right receptor which is responsible for this smooth muscle relaxation. H2 receptor is a right answer for this question because H2 receptor which is present on your pulmonary muscles, in the lungs, it is present in the blood vessels. So that's why H2 receptor, by increasing a level of CAMP and relax the smooth muscles by reducing the calcium availability to form a calcium calmodulin complex. These H2 receptors are responsible for the smooth muscle relaxation, it means vasodilation, as well as bronchial relaxation. So this is a right answer for this question. So the next question for this GPAT series is, chloramphenicol is particularly effective in the treatment of, the options are diphtheria, tuberculosis, emphysema, and icterial disease. So you choose the correct answer, that chloramphenicol is used. The right answer is icterial disease. So this is a type of bacterial infection. You can say it is transferred to the human from you can say butterflies, dogs, cats, like that. So this rickettsia, which is a, you can say, responsible for the infection in the body, shows some symptoms, that is increase little bit fever, redness over the face, fatigue in the body. So chloramphenicol is preferred for this rickettsia, as well as you can say if there will be a next option azithromycin. Azithromycin is also preferred for this rickettsial disease. So this is a right answer for this question. The next question on the Pharma Learning Channel GPAT series is, the drug of choice for scarlet fever is tetracycline, sulfonamide, penicillin, and chloromycetin. So right answer you can choose or comment. The right answer for this scarlet disease, the drug of choice is penicillin. So that means penicillin is preferred for this infection. Instead of penicillin, we can use amoxicillin along with clavulanic acid. So that means augmentin or amoxiclave. So this is a second right option for this question, that penicillin, if you can say, is not here in the option, and in the GPAT there will be option of amoxicillin with clavulanic acid, then it is also a right answer for this type of infection. So the next question is, the plasma half-life of penicillin G is longer in the newborn because the options are plasma protein level is low, drug metabolizing enzymes are immature, glomerular filtration rate is low, and tubular transport mechanism are not well developed. So you choose the right answer for this option. The right answer is tubular transport mechanism are not well developed. So basically what happened, you know that due to abnormal GFR in case of newborn baby, there is a excessive accumulation of penicillin G in the body, in the blood. Instead of that, there are these secondary options, that you can say that in case of newborn, if this is not a option available there, then these are also a right option, that newborn have low plasma protein level, because you know that if there is a low plasma protein level in your body, then you know that free drug will be available in your blood, and it will start to circulate in your blood for a long time. So this can also be a possible cause for this excessive half life of penicillin G or some other drugs. The next question is, fluoroquinolones are the drug of choice in. The options are staphylococcal infections, salmonella infections, viral infections, amoebic dysentery. So you choose the right answer for this question. The right answer is salmonella infection. So salmonella typhi is a type of, you can say, infection with the bacteria which is present in the blood or in your body. This is responsible to increase the temperature in the body, as loss of appetite, hot flushing, fatigue, alter the muscular metabolism. So that means fluoroquinolones are preferred here, levofloxacin, ofloxacin, ciprofloxacin. Instead of that, chloramphenicol. So these are also the choice of drug for the treatment of this infection. So this is a right answer for this question. The next question is, the antibiotics that enter the brain freely. The options are tetracycline, erythromycin, doxycycline, gentamicin. So you can choose the right answer for this. That means those antibiotics which cross the blood-brain barrier and can reach in the cerebrospinal fluid. So the right answer is doxycycline among these. Instead of doxycycline, there is a increased penetration of the chloramphenicol in the blood-brain barrier, or it is available in the cerebrospinal fluid. So these are the drugs which are sometimes preferred for the meningitis or some other bacterial infections. So this is a right answer for this question. The next question is drug of choice for ringworm infection is. The options are griseofulvin, amphotericin B, nystatin, and neomycin. You choose the right option for this ringworm infection. The right answer is griseofulvin. So instead of griseofulvin, you can say that itraconazole. So suppose in the GPAT there is an option with you that instead if there is a no availability of griseofulvin in the option, what you can do if there is a itraconazole or ketoconazole or then griseofulvin. So you can say that itraconazole is more effective, griseofulvin equally is effective, and ketoconazole is less effective than the itraconazole. So this is a right answer among these options. So that's why this is a drug of choice for the ringworm infection. The next question is, which of the following is most effective in the treatment of peptic ulcer disease? The options are bromocriptine, cimetidine, proton pump inhibitors, and ketaserine. So you choose the right answer. So the right answer for this question is proton pump inhibitor, or sometime you can say proton pump inhibitor are preferable in the peptic ulcer disease during the initial therapy. Instead of that, ergotamine, if there is a option in the GPAT, then it is also better as compared to other these three. So this is a right answer for this question. The next question is, metronidazole is least likely to be effective in the treatment of amoebiasis, giardiasis, pneumocystis, and pseudomembranous colitis. The right option for this question you can choose. The right option is pneumocystis is a right. You can say metronidazole is least likely to be effective for the treatment of this pneumocystis. So that's why it is effective for amoebiasis, giardiasis, like that. So metronidazole, which is preferred for this type of infection, at least minimum for 7 to 14 days. So if there will be a here option like how many days a person can use metronidazole, the maximum time is 14 days. So this is a right answer for this question. Next question is the vasodilator that can be inactivated by proteolytic enzyme. The options are angiotensin 1, vasoactive intestinal peptides, histamine, and neuropeptide Y. So you choose the right answer for this question. The right answer is vasoactive intestinal peptide. So these vasoactive peptides are vasodilators and they sometimes are degraded by some proteolytic enzymes. So that's why there is another option in the GPAT you can choose. These vasoactive intestinal peptides are never administered orally and they are degraded and their effect will not be therapeutic. So this is a right answer for this question. The next question is the peptide that cause increased capillary permeability and edema in the body is. The options are angiotensin 2, captopril, bradykinin, and histamine. You choose the right answer. The right answer for this is bradykinin. So you know that bradykinin, they are having some receptor B1, B2. So by acting on B2 receptor, they cause vasodilations. So that means instead of that, if there is a option here, the question will be which one of the following cause increase in the inflammatory insult. during the time of injury. So that option will be bradykinin, because bradykinin enhance the inflammation in the body. So that's why this is due to the vasodilatory effect or increased permeability of any ion, any mediator across the membrane. So this is the right answer. The next question is, select the drug which can improve urinary flow rate in benign prostatic hypertrophy without affecting prostate size. The options are amphetamine, prazosin, finasteride, and gosirelin. You choose the correct answer among these. The correct right answer for this is prazosin. So prazosin, you know that it is a alpha 1 adrenergic blocker drug which was used as an antihypertensive, but due to its side effect like orthostatic hypertension, this is not preferred and useful drug nowadays as antihypertensive. Instead of that, this prazosin is a drug of choice for this benign prostate hypertrophy, where this is more affecting to male, and male they are suffering from difficulty to passing out the urine from the urinary tract. So that means this benign prostate gland, which will responsible for the constriction of ureters, and that's why it is difficult to move out the urine from the urinary tract. So this is the right answer for this question. So the next question is, plasmodial resistance to chloroquine is due to change in receptor structure, decrease carrier mediated drug transport, increase in the activity of DNA repair mechanism, and induction of inactivating enzymes. You choose the right answer for this question. The right answer is decrease carrier mediated drug transportation. So that means during the plasmodium infection, the resistance which is developed against chloroquine is due to low entry of the drug through the membrane of the bacteria due to unavailability of carriers. So that means this drug is cross against the membrane of bacteria by carrier mediated diffusion. So this is the right answer for this question. The next question is, drug of choice for actinomycosis is, options are penicillin, tetracycline, sulfonamide, and dapsone. You choose the correct answer for this. The correct answer is penicillin. So penicillin is preferred for actinomycosis infections because this penicillin easily cause produces side effect in these particular type of the organisms. So the next question will be, prolonged chlorpromazine therapy results in extrapyramidal effects, photosensitivity, yellowish discoloration, and altered renal function. You choose the correct answer. If anybody use chlorpromazine for a long time, the answer is extrapyramidal side effects. So what are extrapyramidal side effects? Likely you know that some drug cause PD like produce Parkinson like symptoms, or you can say they produce dyskinesia. So, long-term use of chlorpromazine produce a PD-like symptom in the persons and also produce a dyskinesia. So that's why this is the major side effect or long-term side effect of this chlorpromazine. The next question is, sulfonamides are primarily metabolized by acetylation, gluconidation, ethyl sulfate formation, none of the above. You choose the right answer. The right answer is acetylation. So sulfonamide firstly undergo acetylation, and acetylation followed by oxidation. So this is the reaction in the liver, the phase 1 reaction and phase 2 reaction, where you can say the sulfonamide they undergo acetylation and metabolized in the body. The second last question of this series is all of the above, all of the following chemotherapy agents work through affecting microtubule functions except docetaxel, vinblastine, mitozentron, and vincristine. If you choose the right answer for this question, the right answer is mitozentron is a drug which never act through microtubule function, which always act by inhibiting the T cell and B cell dependent immune response. So it inhibits the T cell and B cell activation. This is not a right mechanism for this drug. So other act through these type of the actions. So that means these are the anti-cancer agents. So these docetaxel, vinblastine, they affect microtubule. That's why bundles will not be formed. So that means cell will not be grow further. So this is the wrong answer for this. The last question for the GPAT series is which of the following is a first line drug to treat tuberculosis? So the options are PAS, pyrazinamide, rifampicin, ethonamide, and cycloserine. You choose the right answer. The first line drug. The first line drug is rifampicin. So the rifampicin is a first line drug, and if the option is the drug which cause killing of TB bacteria before infection, so that means at the time of division, the drug which kill this microorganism, tuberculosis microbacterium, this is again a right answer, rifampicin, because rifampicin kill the bacteria before causing the infection. So this is a right answer for this question. So hope this series was very useful for you all, and you all watch, like and subscribe this channel for getting more video in the coming time and to clear more concept about this pharmaceutical sciences. You are welcome. Thank you very much.